Hi, everyone. My name is Blake Cadwell. I'm the co-founder at Soundly.com, where we talk about all things sound and hearing health. And in this video, we want to talk about one of the most foundational aspects of choosing a hearing product. And it has nothing to do with technology or form factor. We have lots of other videos on those topics. Today, we want to talk about care models. And to cover this topic, I'm joined by Dr. Amy Sarow, who's our audiology lead. And Dr. Amy, can you just start by giving us a quick overview of why it's important to think about care models in addition to the underlying technology that you're purchasing?
At the heart of it is, what type of experience are you looking for? Some people like to have more support. Other people are more independent and they don't need as much support. You can think of it a little bit too, like when you go to buy furniture. If you go to IKEA, you get those instructions and you're going to be putting things together on your own. You're more independent versus, paying somebody to do the assembly for you or, buying it pre-assembled. It's a little bit like that. So some people have a more complex hearing loss, or they like to walk through things in person. They like to have that customized approach to things. That's going to be more of an in-person in a clinic setting, a local audiology clinic. And then there are care models where it's telehealth, where you're getting some support, but it's not going to be in person. And so you get that combination of a little bit of independence, but then also support. And then over-the-counter options, those are going to be more, you're independent, you're doing things more on your own.
So we know every person is different and has different preferences and needs, but can you share in general who might be a good candidate for each of these care groupings that you've just described?
Certainly. So for an in-person, in-clinic experience, that's going to work for people who have a more severe hearing loss, definitely. So someone who needs an ear mold, who's outside of that mild to moderate hearing loss range, they should see someone in person, work with a local clinician. If they have a more complex case, maybe they've had surgeries on their ears, or they have a challenging shape or configuration to their hearing loss. It could also be someone who has trouble because of dexterity reasons with cleaning and maintenance of their hearing aids. So they can coordinate with a local clinic and drop them off or get on a regular cleaning schedule. Someone who needs, to walk through information step by step. Am I pushing the right button? Am I putting my hearing aid in correctly? Can you help me to do this in person? Maybe some customization with programs or specific care needs like that. All of these types of needs or hearing losses are going to be best managed in an in-person clinic. And then telehealth is going to be someone who has mild to moderate hearing loss. They don't necessarily need a custom mold. They're comfortable doing video and phone calls, without having someone assist them. They're more independent. And then over-the-counter hearing aids will work for people with mild to moderate hearing loss. They're comfortable doing things on their own. They're comfortable using a smartphone. Maybe they have a more limited budget, and they're looking for a place to get started. That person is probably a good fit for that over-the-counter model.
If you take one thing away from this video, it's that choosing the right care model matters just as much as choosing the right technology. And you can use Soundly.com to sort by care model and compare each of your different options on our site. So Dr. Amy, thank you for your time. And to you, the viewer, we wish you the best.